Good morning, everyone. Today we have a very great doctor, Mithun Das from SMI Hospital in Gaya. So today we are talking about diabetes. All we know that diabetes is a very serious issue, not in India, all over the world. So today we are talking about diabetes. Sir, please tell us about diabetes.
Actually, diabetes generally in form we are telling that when patient is having that high blood sugar, we call it diabetes. General cutoff for the fasting blood sugar is 110 and postprandial is 160. But if patient's sugar level increases, then we call it patient is having diabetes. Like from 110 to 140, we are telling as pre-diabetic or pre-diabetic groups fasting sugar, or postprandial sugar is up to 200, we are calling that pre-diabetic groups. If it crosses 200 postprandial, or if it crosses 140 fasting, then we are telling that patient is having diabetes. So this is, diabetes is having impact on all the body parts. The eye is also involved in many conditions. Many of the eye parts can get involved due to diabetes.
So what are the common symptoms of
Common
diabetes?
symptoms of diabetes, in eye perspective, eye can have three types of main problems. One is cataract, it can develop cataract. Chances of getting glaucoma is also higher, and chances of getting diabetic retinopathy is more in case of diabetes patients.
Is it a prevented?
Yeah, it is preventable if patients is getting that regular eye checkup. We recommend that at least when patient is diagnosed with diabetes, that time once checkup. If everything is normal, then yearly once at least checkup should be is mandatory.
Can lifestyle change our diet?
Yeah, the patient has to here actually patient has to control his diabetes. So it can be by lifestyle changing, or can be by with medicines, or genetic things we cannot change, but lifestyle and this exercise and medicines, with the help of all these things we can control the diabetes.
Okay. When should diabetics see an eye specialist and what are the treatment for it?
As I told you, whenever patient is diagnosed with diabetes, we recommend at the time of that only. And if patients everything is fine, then yearly once checkup is mandatory. And if patient is having some eye problem, then doctors will recommend you accordingly, like 3 months or 6 months or one monthly. That they will decide.
Is there another advice to give it to you?
I tell the patients that there is a common myth. People thinks that if I'll have some defective visions or some problems, then only I'll go to the doctor. So it is not like that. Sometimes the diabetic retinopathy changes are increasing in eyes, but patient don't feel, because at the last stage only they will get some problems. Mostly patients will have, if patients are having some symptoms, it comes either sudden or in slow progressives. Sudden happens due to vitreous hemorrhage, mainly due to vitreous hemorrhage. It can, as a sudden, patients will have sudden defective visions. In that cases, we need surgical interventions. And if it is slowly progressive, it can be two things. One is tractional diabetic retinal detachment, and another one is diabetic macular edema. Treatment is different. Tractional retinal detachment will be managed by surgical intervention, and for diabetic macular edema, we are generally advising NSAID drops, lifestyle modifications. Along with that, sometimes patients may need anti-VEGF injections. So regular checkup is mandatory. And diabetes retinopathy is also having some stages. Like first, it comes as non-proliferative diabetic retinopathy. There also comes mild, moderate, and severe grade. At the last stage, it comes to proliferative diabetic retinopathy. At the stage of proliferative diabetic retinopathy, patients can develop anytime vitreous hemorrhage or tractional retinal detachment. So we recommend the patients regular checkup so that it cannot go to the proliferative diabetic retinopathy stage. Even if it comes initial stages only, we are doing laser so that it can be prevented. If unlasered eye, proliferative diabetic retinopathy, that this damages increases, and patient can get that damage eye.
So thank you so much for spreading awareness about diabetes
Yeah.
and for a great advice. Thank you so much.
Thank you very much.